How might we use AI for the proper use of medicine? Laura Rojas, master student. First, we're going to start this research project with the definition of rational use of medicines. Common types of irrational medicines use are the use of too many medicines per patient, known also as polypharmacy, or the inappropriate use of antimicrobials, often inadequate dosage for non-bacterial infections, or the overuse of injections when oral formulations would be more appropriate, or the failure to prescribe in accordance with clinical guidelines, and the inappropriate self-medication, often of prescription-only medicines. People often have very rational reasons for using medicines irrational. Causes of irrational uses include lack of knowledge, skill of independent information, unrestricted availability of medicines, overwork of health personnel, inappropriate promotion of medicines, and profit motives from selling medicines. So, what is needed in order to assure the rational use of medicines? According to the World Health Organization, there are core policies to promote more rational use of medicines, and in this project we're going to focus on the number 9, that is the public education about medicines. It's fundamental that governments, health professionals, international organizations be involved in achieving the proper use of medicines. Another important part is that the population understand the importance of knowing the risks and benefits of using medicines, and also how to use them. People will often not get the expected clinical outcomes and may suffer adverse effects. That is why governments and other institutions need to ensure that information includes medicine name, indications, contraindications such as drugs interactions and warnings concerning unsafe use or storage. Also, complete education about the use of medicines. Let's complement this information with an interview made to a specialist, Germán Rojas, chemical pharmacist and CEO in Seed Pharma.
¿Por qué es importante que el paciente entienda lo que el médico prescribe?
Porque la prescripción médica implica darle al paciente los medicamentos que son necesarios para poder mejorar su estado de salud. Entonces el paciente debe conocer qué cosa es lo que debe hacer para recuperar su salud. Por eso creo que es importante.
Okay. ¿Cuál es un proceso normal después de que el médico hace un diagnóstico y receta un tratamiento?
Una vez que el médico hace el diagnóstico, es decir, identifica qué problema de salud tiene el paciente, entonces puede indicarle que use ciertos medicamentos. Entonces, si es que eso es así, el paciente tiene que entender claramente qué medicamentos va a usar, qué medicamentos le van a administrar, por cuánto tiempo, en qué momento, ¿no? Y qué precauciones debe tener. Entonces el médico tiene que orientar al paciente para que el paciente cumpla con su tratamiento de la mejor manera posible.
Si un paciente tiene dudas sobre cómo tomar un medicamento, ¿a quién suele recurrir?
Cuando un paciente, tiene dudas de cómo consumir el medicamento, por cuánto tiempo, en qué dosis, debería acudir a un establecimiento farmacéutico, donde el farmacéutico le podría orientar cómo debe administrar ese medicamento, es decir, en qué dosis, por cuánto tiempo, antes o después de los alimentos, ¿no? Y de tal manera de que el paciente se sienta con confianza y poder cumplir con el tratamiento que le ha indicado el médico, ¿no?
¿Cree que la población en general conoce de los términos y para ellos es sencillo entender lo que debe hacer?
Yo creo que no es muy sencillo para la población entender la importancia de un tratamiento cuando el médico le prescribe. Por lo tanto, los médicos y los profesionales de la salud en general deben estar preparados para orientar en todo momento al paciente para que cumpla su tratamiento. Porque en la medida que cumple el tratamiento, el paciente va a recuperar su salud. Entonces, debe acudir o al farmacéutico o recurrir al mismo médico para poder recibir una orientación adecuada y cumplir con todo el tratamiento indicado, ¿no?
Let's make a recap. How is the process when someone is ill and needs a treatment? If it's start feeling sick, then go to the doctor, have a consultation, then an examination that might include a blood test or hospitalization, then a prescription in most of the cases, and if he or she follows the treatment, finally he or she will recover. What's the opinion of a patient? Let's hear Lorraine Ponce talking about this.
For me, it's not that easy to understand the right way of taking medicine after a doctor prescription because in the case of Peru, you receive the receipt by hand of the doctor. You don't receive in a digitalized version. So sometimes it's hard to understand the handwriting. And when you are on the appointment, listening all the diagnostic that the doctor is saying about your pain or the reason of your visited, you're not so focused about the indications. But then when you receive the receipt, you also are not so aware or you are not understanding properly the instructions.
In order to give a solution to the problem of how a patient uses medicines in a correct way, I'm going to talk about AI in health and chatbots and personal assistants because it's a recent and emerging technology trend that has a potential disruptive impact.
We have an algorithm to do to adapt a human behavior. Mm-hmm. And like for me, human behavior, it's not calculating because of course calculators can calculate better and faster than humans, but that's not AI. Yeah. But it's cognition thinking or feelings, for example, or these things that are intrinsically human. It's a tool, then it's used in AI, then it's basically how to make computers learn from a set of data. Yeah, but just machine learning, it's not AI. It's just to do AI, you use machine learning.
To make a recap, artificial intelligence is a program that allows to emulate human behavior, can sense, reason, act, and adapt. It uses machine learning as a way to learn because machine learning are algorithms that can improve based on how exposed to data over time they are and how structured it is. And finally, deep learning learns from vast amounts of data but using numerous layers of these algorithms, each of them giving a different interpretation to the data it has. There are several opportunities for introducing a digital personal assistant or a chatbot to help physicians, nurses, patients, or their families. For example, better organization of patients' pathways, medication management, emergency situations, or with first aid, solution for simple medical issues. The goal in the future is that these smart algorithms become the first contact point for primary care. There are more benefits. Machine learning helps us to improve our data. The result is increasing in efficiency without sacrificing quality. For example, after hours, informational, specific task-oriented. Another trend that we are using in our solution is image recognition. That it's a term used in computer technologies that can recognize certain people, animals, objects through the use of algorithms and machine learning concepts. If we want to see more impact, let's see how artificial intelligence in healthcare is working nowadays. We know about chatbots. We're going to introduce another term, AI virtual assistant, that have a wider scope and can perform a range of tasks. They also use artificial neural networks to learn from situations, recognize, classify, and predict based on analysis. We're seeing how it's being used AI and chatbot and personal assistants. The solution presented tries to focus on the information a patient needs after receiving medical treatment from the doctor. But before presenting the organization shows and the prototype, we need to discuss the impact and ethical issues of the trends. One ethical issue that we are trying to address with this solution is the relationship between clinical physician and the pharmaceutical industry that is becoming an important social issue. For example, according to the Telegraph and based on the new research by Oxford University, exists a conflict of interest between doctors and pharmaceutical companies that is difficult to solve. Technology might help to solve one of the issues already mentioned by democratizing information for the benefit of the patient. How about the ethical issues that exist in artificial intelligence? Because bots can learn to be biased. Another ethical issue is the human integrity. Responsible artificial intelligence is about human responsibility for the development of intelligent systems along fundamental human principles and values to ensure human flourishing and well-being in a sustainable world.
I think that like it has a great future and it has a lot of applications in many fields. AI, I see it more like a tool, not a solution, but a tool that we can use it. And in the field of healthcare, I think it is lower to be used widely because it has a lot of ethical issues and regulation. Because when there's a problem there, it can lead to a death of a person or a misdiagnosis.
But we also have a big trade-off in this solution. How can we incorporate this benefit to senior citizens around the world, or in general to people who have technology illiteracy? In some countries, they don't have the infrastructure necessary to control this. Based on the problem found, we have chosen an organization to formulate with them a responsible strategy. Seed Pharma is a Peruvian company that commits with the population through the production, editing, and dissemination of information, educational materials, publication, studies, and intervention projects. Seed Pharma seeks to raise the level of health of the population. Let's see how the solution works, and it's going to help the population and also Seed Pharma to achieve their goal. With this application, you're going to be able to introduce the prescription you've received after going to a doctor by writing it or using a voice message in order to identify how nervous the patient is and how might the application adapt their wording. We are going to use image recognition to identify the names of the medicines because of the complex name they have. The information given about the medication prescribed is going to be in international nor proprietary names in order to avoid the association of the medication with a specific pharmaceutical company. The transcription part helps to use this tool in those countries where the prescriptions are written by hand and it's difficult to understand what's been written. And if you're taking more than one medication, it helps to identify if exists or no medicine interactions. You're going to receive information about when do you need to take each medication and all the recommendations needed. In addition to all the information received, the patient will be able to activate a notification option to avoid forgetting when to take their pills. We tested a solution with 12 users between 20 and 60 years old. The 55% were women and the 45% men. We are going to present some of the comments.
I love the app for Seed Pharma and also to check if there's any prescription that might not be suitable. So it's super nice to have something to assure me the prescribed dose and how often should I take it, and especially for how many days. It could be also nice if you could add other users to track the medicine.
That's a really nice prototype. But for the part for people to upload the prescription, I think it's a bit tricky because from that we need like image recognition and character recognition. Then like technically maybe it's a little bit complicated. I think it's good. It has everything that I'm thinking. It's here.
And that is how AI allows us to give a lot of benefits for the population based on the present to future capabilities, virtual assistant and chatbots, and also image and letter recognition half in time. Help to identify mood of the patient, give him or her a transcript of the prescription, educate with the complete drug information, give him or her the interactions between medication, avoid brand association and conflict of interest, and give notifications for the patient.